Today during our therapy session, we have a lady named Bernice. Bernice is 48 years old and she had a stroke. She had an embolic stroke that occurred September 30th, 2015. Bernie was out walking her dog when she collapsed to the ground. Unable to move her right side, the neighbors saw it and called 911. When paramedics arrived to the scene, she was unable to speak and did not know what was going on. Once arriving to the hospital, Bernie received a CT scan. They recognized the stroke and was immediately taken to a bigger hospital to receive better care. Bernie was diagnosed with Broca's aphasia along with mild apraxia and right visual neglect. The type of therapy being used in today's session is an expressive anomic therapy. We made Bernie an object box full of everyday essentials including an orange, a spoon, a cup, a straw, a pen, and a cell phone. We will start by showing Bernie the object and then using a few different types of cueing methods to determine if she is able to come up with the word on her own. And notice the clinician has to show the patient the object on her left side due to her right side visual neglect. Starting off, Bernie is shown an orange, and the clinician will give her different open-ended phrases and Bernie must fill them in.
It's a type of fruit. An apple and an orange. Very good.
With the next object, Bernie will be shown a spoon and again be given the open-ended phrase cueing.
A fork and a orange. You eat soup with a orange.
Notice that the patient is perseverating on the previous object. Therefore, she will need to be given an additional cue of phonemic cueing.
It's an spoon.
For the final object in the box, Bernie will work on a more difficult technique, circumlocution. This method is used when the clinician is not present, so the patient must learn how to find the word on their own in their everyday life.
Can you tell me what this is? You drink hot, cold, cup. Very good.
Once Bernie masters therapy using objects, she'll move on to using photographs, which tend to be harder than the concrete items. Expressive anomic therapy is one of the many therapies used to treat Broca's aphasia. And this ends today's therapy session.